Hello, it's Dr. Rhonda Johnson. Today is Monday, April 10th, 2023. Today I'm talking about kidney disease. And April is National Minority Health Month. And according to the National Kidney Foundation, people of color, African Americans, Alaskan Natives, American Indians, and Hispanic people have much higher rates of kidney disease than white Americans. In fact, Alaskan Natives and American Indians and African Americans are 3.5 times more likely to develop kidney disease than white Americans. Being an African American, I know far too many people who have had end-stage renal disease, ended up on chronic hemodialysis, and their quality of life suffered greatly. But first, let's do a basic overview of the kidneys, what they do. They're two bean-shaped organs. You know those kidney beans that you may eat? They look just like that. They're about the size of a fist. They're much larger. They're located below your rib cage on each side of your spine. Your kidneys filter, when they're healthy, about a cup of blood every minute. They remove waste. They remove extra water to go back into the bloodstream, and they cause the formation of urine, which is how you excrete toxins from your body. So what are the risk factors for kidney disease? Diabetes, high blood pressure, having a positive family history, being obese and overweight, being older than 60, racial and ethnic groups, Black, Native American, Alaskan Native, Hispanic race and ethnicity, have much higher rates of kidney disease and renal failure. A lot of that's due to higher prevalence of diabetes, obesity, and high blood pressure. Some medications, like chronic over-the-counter medications, non-steroidals, can increase your risk of chronic kidney disease. Smoking, people who have been hospitalized with COVID and had kidney injury from the COVID infection or were on dialysis, they retain a higher risk. And women who have had preeclampsia, severe preeclampsia, or postpartum preeclampsia may be at a higher risk. So what I'm saying today applies to anybody with risk factors. So what are some of the warning signs? Well, from the National Kidney Foundation website, they list 10. You're more tired, you have less energy, you have trouble concentrating, you have trouble sleeping, you have trouble with dry and itchy skin, you're urinating more often, you see blood in your urine is foaming, you're experiencing puffiness around the eyes that persists, you have swollen feet and ankles, your appetite is poor, your muscles are cramping due to mineral and electrolyte imbalances. Now, these are non-specific to kidney disease. You can have these with heart failure, you can have them with liver disease. So again, the main point is see a doctor. Don't try to diagnose this yourself. See a doctor if you have these symptoms, because there may be something wrong. So how do you get screened? I think screening is so important. You should ask your doctor to screen you for kidney disease once a year if you're in any of these high-risk groups. One is a urine test. Ask for write this down, UACR, urine albumin to creatinine ratio test once a year. It can detect how much albumin, which is a small protein, is spilling over into your urine, which is one of the first signs of chronic kidney disease or kidney damage. And the other is a blood test. Ask for EGFR, stands for estimated glomerular filtration rate. It measures how well your kidneys are functioning in your blood. So talk to your doctor, see a doctor if you think you can have chronic kidney disease, because there are new medications that are out there. I also want to do a shout out for a program called the Black Health Trust. It comes on Sunday afternoons from 4 to 5 Eastern Standard Time. Go to their website, www.blackhealthtrust.org. The president or founder of this nonprofit free service, Dr. Randall Maxey, gave an excellent presentation. He is one of the best kidney physicians in the country, in my opinion, and he gave an excellent presentation on kidney disease in African Americans yesterday on April 9th. You can find it on their YouTube channel, and I'll put it in my comments. Take care, folks. I know I'm rushing through. I can't cover it all. You'll find a lot more information on that these websites that I mentioned. But know and be aware and get screened and modify your lifestyle to cut down on your risk of smoking, high blood pressure, diabetes, being overweight, and you drastically reduce your risk factors for kidney disease.